Welcome to the Lower Mainland Pharmacy Services instructional video for hand hygiene and garbing. Anyone who enters the sterile compounding controlled work areas must follow these procedures. Before entering controlled work areas, notify your supervisor of any illness or health condition that may affect compounded preparations, remove all outer garments, jewelry, and cosmetics, and don clean, low-shedding clothing, socks, and closed-toe shoes. Anyone accessing the clean side of the anteroom or the clean room should wear scrubs, and cover their scrubs with a lab coat or gown if they leave the controlled work area. Items such as eyeglasses or ID badges should be cleaned regularly, and no food, drink, or personal electronic devices are allowed. Perform routine hand hygiene prior to entering controlled work areas. You can use regular alcohol-based hand rub from the hospital dispensers, or plain soap and water. Begin donning garb in the anteroom or segregated compounding area. You will need a hair bouffant, optional beard cover, face mask of your choice, and shoe covers. In general, we don garb from top to bottom and dirtiest to cleanest, beginning with the hair cover and then putting on a face mask. For hazardous sterile compounding, an N95 mask or respirator should be worn when cleaning spills outside the hood or when decontaminating or cleaning the biological safety cabinet. Shoe covers are donned as you step across the line of demarcation, which is a real or virtual line that separates the anteroom or segregated compounding area into dirty and clean sides. This line could be an actual line on the floor, the threshold of a room, or a raised barrier. Don one set of shoe covers for non-hazardous sterile compounding. Don a second set of shoe covers for hazardous sterile compounding. The second set will be removed as you exit the hazardous clean room. The order in which you don your hair cover, face mask, and shoe covers may be different based on the room layout at your site. Check with your supervisor for site-specific instructions. Next, we perform surgical hand hygiene. You will need a plain neutral soap such as Hygienipack Pure, a nail pick, and an alcohol-based hand rub with persistent activity such as ManoRapid. Wash hands and forearms up to the elbow for 30 to 60 seconds with soap and water. Clean nails with a disposable nail pick once each shift during the first time that hand hygiene is performed. Rinse thoroughly, keeping the hands elevated. Then dry hands and forearms by patting with a low-shedding, single-use cloth. Next, we don a gown and gloves. You will need a disposable or reusable gown for non-hazardous compounding, or an impervious disposable gown for hazardous compounding. Sterile gloves if you are a compounder, or non-sterile gloves if you will be checking or performing other activities outside the laminar airflow hood. Don gown, then push up sleeves to prepare for application of alcohol-based hand rub. Prepare sterile gloves by opening the outer wrapper onto a clean surface. Apply alcohol-based hand rub with persistent activity to all surfaces of forearms and hands, keeping the areas wet for at least 1.5 to 3 minutes for proper disinfection to occur. Then lower your gown sleeves. Alternatively, you can apply alcohol-based hand rub to all surfaces of the forearms, don your gown, then apply rub to hands and fingers. Allow hands to dry completely, then don sterile gloves. Don the first glove by grabbing an inner surface and sliding your hand in. Then don the second glove by slipping the sterile gloved hand in the cuff of the second glove and slide your ungloved hand in. Ensure gloves cover the cuffs of your gown. Don 2 pairs of sterile chemotherapy gloves for hazardous compounding. The cuff of the first pair should go under the gown cuff, and the cuff of the second pair of gloves should go over the gown cuff. Disinfect gloved hands by wiping or pouring sterile alcohol onto gloves prior to entering the primary clean air device and regularly throughout compounding. Change gloves approximately every hour for non-hazardous compounding and approximately every 30 minutes for hazardous sterile compounding. Between glove changes, hands that are not visibly soiled may be cleansed with alcohol-based hand rub with persistent activity. Otherwise, perform full hand hygiene between glove changes. Remove garb in the same area in which you donned it. Remove gloves. For hazardous gloves, the outer gloves should be removed inside the primary clean air device, and the inner gloves should be removed after all other garb. Remove gown prior to stepping onto the dirty side of the anteroom or segregated compounding area. Chemotherapy gowns should not leave the hazardous clean room. Gowns may be saved for subsequent use on the same shift if not visibly soiled. Remove face mask, hair cover, and shoe covers on the dirty side of the controlled work area. Wash your hands with plain soap and water and you're good to go.